Hi, good morning. Welcome everyone to Airlink's webinar, Four Storms, How Nonprofits Responded in the Gulf Coast During a Pandemic. My name is Cindy Rocha, and I am Airlink's Capabilities Development Manager. We're just gonna wait a couple of minutes, one or two, for everyone to join, and then we're gonna get ready to start. Meanwhile, please feel free to introduce yourself in the chat. You can tell us who you are, what organization you're working for, and where are you joining from. Welcome once again to the webinar Four Storms, How Nonprofits Responded in the Gulf During a Pandemic. This webinar is part of a series of learning events that Airlink has been conducted over the last week and this week with our NGO partners. And today we're going to be talking about how organizations in the Airlink network have been responding to the very intense hurricane season in the Gulf Coast of the United States in the midst of the COVID-19 pandemic. On the next slide, we're going to start with a little bit of housekeeping before we dive in. The line is muted, as you can notice. It's going to be stay muted throughout the webinar in order to maintain the recording quality. This webinar is being recorded and it's going to be available afterwards for everyone who registered and who would like to learn about it on Airlink's website. But you can all use the chat box to share any comments, reactions, or questions. There is also a Q&A option available in Zoom that you might use to direct questions to the panelists. And finally, you can also engage in social media. We're going to be tweeting during the session with the hashtag #AviationCares. As I said, today we're going to be learning from two organizations in Airlink's network, All Hands and Hearts and the Information Technology Disaster Response Center, or ITDRC. And they are going to be talking about their innovative responses and the challenges they face. We're also going to learn about Airlink's regional response framework and our activities during this hurricane season. So before starting with the webinar, on the next slide, I'm going to have the pleasure of introducing our speakers for today. We're going to have Gary Pitts from All Hands and Hearts. He's the Chief Operating Officer. He first joined All Hands and Hearts as a volunteer in December 2013. And he said he was going to stay for about 10 days. As we can see, he's been there for a bit longer. Gary has worked in many roles within the operations team, ultimately spending 3 years as the Director of International Response and leading the International DART team for a total of 5 years. In line with All Hands and Hearts' recommitment to safety, in January 2018, Gary began developing and implementing an organization-wide safety management system. Gary recently became the Chief Safety Officer, and he's playing a lead role in the safe return to operations after COVID-19 crisis. Prior to joining All Hands and Hearts, Gary served as the Chief Technology Officer for a UK tech company. Welcome, Gary. We're very glad to have you here.
Thank you. Great to be here. Looking forward to it.
Excellent. We're also joined by Joe Hillis, who is the Operations Director at the Information Technology Disaster Resource Center, ITDRC. He is a systems engineer and technology consultant with a focus on disaster resiliency. He is also a co-founder and National Operations Director for the ITDRC's field operations on more than 75 federally declared disasters. Joe brings more than 25 years of frontline experience in both public safety and information technology, and he has served as an advisor to FEMA on various initiatives. His contributions have been recognized through a number of awards, including from the Department of Homeland Security at the White House event. Joe holds a number of industry credentials, which combined with years of disaster response gives him what he calls a 360-degree view on disaster technology. We're very glad to have you here, Joe. Welcome.
Good morning. Thanks for having me.
Excellent. And last but not least, I'm very glad to introduce my coworker, Bethany Holland. Bethany is the Humanitarian Programs Manager at Airlink, and she supports Airlink's expanding regional operations and capacity building efforts within its partner network. Prior to joining Airlink, she provided logistics and program management assistance to the U.S. Department of State's Bureau of Near Eastern Affairs in support of programs in Iraq. Bethany, thank you for joining me today.
Thank you.
So without further introductions, I will now hand it over to Bethany for an introduction to Airlink and our regional response plans in North America. Over to you, Bethany.
Thanks, Cindy. I'm excited for this opportunity to bring our partners together and share our experiences during our ongoing and extensive responses throughout this year's historic Atlantic hurricane season. But first, a quick recap for those who aren't as familiar with Airlink and its regional response framework and operations. Airlink is a rapid response nonprofit organization that provides low-cost airlift for passengers and relief supplies in humanitarian emergencies, both man-made and natural. Our work is structured by a regional response framework that identifies 6 regions of the world, as well as the air carriers, nonprofit organizations, and donors that work within them. This framework allows us to be intentional about what we prepare for in each region, utilizing research and continuous collaboration with our partners. The aim of this framework is to leverage the natural airlift networks created by commercial aviation and leverage their expertise to get the people and supplies to emergencies quickly. In the context of today's discussion, our relationships with commercial airline partners have facilitated travel for critical response volunteers in the wake of multiple damaging hurricanes. Our partners are involved in all stages of emergency relief in the region, from rapid response to recovery, preparedness, and resiliency. Through these partnerships, we're able to forge relationships with larger coordinating bodies as well, and nonprofit coalitions such as National VOAD and FEMA. And finally, in 2021, we'll be working to sign formal partnership agreements with our nonprofit partners to demonstrate a substantial and well-rounded humanitarian support network in preparation for emergencies and disasters within the region. Our North America regional response plan consists of the United States and Canada, but for today's session, we'll be focusing on the Gulf Coast region of the southern US. In this regional response plan, it's certainly our strongest and where we've responded most frequently, especially this year. Within this regional context, our partners respond to a wide range of disasters, including hurricanes, derechos, tornadoes, flooding, wildfires, and now a pandemic. Due to the geographical size of the region, there can be a wide range of disasters, which certainly complicates centralized preparedness efforts and causes additional challenges and constraints. Our responses to the majority of this year's Gulf Coast hurricanes, Laura, Delta, Sally, and Zeta, fall under this regional response plan. So as I mentioned, our North America Regional Response Plan is our most active. Over the last 10 years, we've responded to over 15 hurricanes and tropical storms, 4 deadly tornado events, 4 wildfires, 5 floods, 1 derecho, and now 1 pandemic. In 2020 alone, we've continued Hurricane Harvey recovery efforts, responded to the Nashville tornadoes earlier this year, West Coast wildfires, the derecho in Iowa, and the mini hurricanes that have hit the southern US. And we also continue to support our partners as they respond to COVID-19. In response to hurricanes Laura, Delta, Sally, and Zeta, we provided over 340 flights for 11 NGO partners across 18 responses. And thanks to our airline partners at United, Southwest, and Alaska Airlines, and with a generous donation from Deloitte, we have been able to deliver nearly 250,000 in flight value to these critical response efforts. Sorry about that. These responses have provided medical aid and assistance, search and rescue efforts, crisis cleanup and debris removal, muck and gut for damaged residences, meal distribution, and the list goes on. Our partners supported communities in need and overlooked populations working to recover in the wake of these storms. We have partners who are working with the deaf and hard of hearing communities to ensure there is access to lanterns and light sources. And as Joe will discuss shortly, our partners at ITDRC work to ensure volunteers in impacted communities have access to the necessary connectivity. All of this to say, we are still responding to these disasters in the midst of a global pandemic. Throughout our coordination efforts in response to this season's hurricanes, for example, we found that the usual partners who would request passenger support were depending on local networks for volunteers. Many of our partners have been shifting operations to utilize local volunteer networks while determining travel policies. As we've all experienced, COVID-19 has impacted all disaster and recovery responses this year. Airlink began its COVID-19 response in February, supporting our partners sending aid to countries in Asia who were first impacted by the virus. This quickly expanded to include countries throughout several of our regional response frameworks. Over the past 10 months, this response has grown to encompass almost every corner of the world. Airlink has now moved more than 9 million pieces of PPE and medical equipment as part of a movement of more than 475,000 pounds. Ultimately, we've worked alongside our partners within the aviation community to help nonprofits save more than $2.5 million in transportation costs across COVID-19 and other emergencies. And that's why we're all here today. As a sector, we've learned a lot this year, and it's vital that we take these lessons learned and apply them to future emergency responses. I'm excited to hear from our partners that we've been coordinating with extensively during our pandemic and hurricane responses, and I hope you all enjoy today's session as well. Before I give the floor back to Cindy, I'd like to remind our participants that this webinar series has a few more exciting sessions this week. We hope you'll join some or all of those sessions, as well as inviting your colleagues to listen in. Thanks, Cindy.
Thank you, Bethany, for this introduction. I'm gonna now hand it over to Gary for the response of all hands and hearts.
Thank you, Cindy. Thank you, Bethany. So my name's Gary Pitts, the Chief Operating Officer at All Hands and Hearts. I want to start off by saying a big thank you to Airlink and your airline partners. I've worked with you as part of All Hands and Hearts for many years now, and it's really been an invaluable partnership. So I'll start by saying thank you. If we could move on a slide, I'm not sure if that's something I have control of. I do not believe it is. Thank you, making it look slick. So before we get into what we did in response to COVID, I think it's important to understand where we started from, to understand the challenge that we faced. So All Hands and Hearts really exists to offer volunteers, really anyone with the heart to help, a responsible way to do so. We did that in a way that really was on their terms. The volunteer could come for a day, for a number of months. There really was, we tried to be as open as we possibly could be. We housed people in our base. That was seen as essential because as a community makes progress after a disaster, we want that community to go back to normal life. They've already been disrupted by the disaster, so therefore we bring people in from the outside to enable the affected community to get back to normal. And when we brought them in, we filled them to the rafters. Really as far as the fire regulations would allow, we'd get them in the building. Very, very much a shared environment. In some ways, you could say a great place to spread a virus, unfortunately, for this context. So if we could move on to the next slide, please. Excellent. So by the 12th of March, the signs were in place, and it was clear that we needed to suspend operations. There we go. Thank you. So that followed the WHO declaring a global pandemic on the 11th, but we'd seen this coming, we prepared. So over the next 5 days or so, we repatriated over 500 people from 8 locations all across the world. That took all around 5 days to do, which was quite an achievement. So we're now paused, and at this point, we anticipate that we will be returning to work in September, roughly 6 months later. I think we can all look back on that and say that was very optimistic at that time, but that's where we were. So if we could carry on, please. So as soon as we had stopped our operations or paused operations, got everyone home safely, the task of working out how we get back to work immediately began. We quickly realized that we couldn't remove the threat. Instead, we had to manage it and reduce it where possible. First off, we consulted with a series of experts to really understand the threat. At that time, a lot of this terminology was new to all of us. So we worked with people that already understood that to help us complete comprehensive risk assessments to highlight areas of risk. And then we shared that throughout our organization. We then formed a series of working groups to really focus on the different areas of risk and propose solutions to a panel. Maintaining situational awareness was a really vital part of getting back. And that really broke down into two pieces. First, monitoring those locations that we'd left and committed to return to. And again, that was across the world, across many different continents. But also once we had deployed the teams, giving them a system that allowed them to monitor the situation that they're working in. And we built our model to allow us to flex within different ratios of risk, depending on what was going on in the specific area. Using the risk assessment data and that contextual information that we'd gathered, we started to design a series of controls to protect against those risks and those hazards and threats that we'd identified. We did this by breaking down things into areas of risk on our base, in our work, and in the community. For us, on our base really means at home. Again, when people finish work, they come back to our base. And so we had to address that. Many of those measures really included things which now have become commonplace. The use of masks, social distancing, regular health checks. At the time, it was a whole new world for us, and now they really become normalized. The way that we housed people really did present a problem, but again, for the reasons that I explained, we felt that was core to what we did. Just coordinating local volunteers isn't always going to get us to where we want to be. To enable a safer housing environment or a more manageable housing environment, we implemented what we termed bubbles at the time. And the aim there was to compartmentalize the population of that base into smaller teams. A bubble would provide a small group with their own home within the base, if you like, and it included designated sleeping space, washrooms, and cooking facilities. We also tried to make sure we have outdoor spaces so teams could have limited interaction between themselves while still maintaining kind of physical distancing and our standard minimum standards was the word I was looking for. We also had to make a really tough decision around people that were more susceptible to severe illness from COVID-19. So we asked those that did have underlying medical conditions or, according to the experts at the time, were over 65 to not join our programs. Again, for us, that was a huge step away from the usual open door that we're used to offering. But again, it seemed the appropriate way to reduce the potential severity, again, bearing in mind that we couldn't completely remove the risk of COVID-19 within our environment. Finally, we had to have a good response plan. Again, we can't rule out that COVID-19 would come into our environment. So instead, we wanted to make sure that we had enough resources and processes in place to enable us to quickly respond and address that. As we sit today, we're seeing both the merits and challenges of that model. We have had a number of suspected cases and even a small number of confirmed cases of COVID-19 within our bases. But the measures that we've designed and the response plans have meant that has remained to a small group within the base. So whilst we have quarantined people, the rest of the group have not shown any symptoms, continue to test negative. So far, so good. Now, for all of those changes, and I can go into much more detail on those, I can bore you to tears, but for all of those, we still had a factor to consider, and that was the period that people would come and go for. Again, it's very hard to, we're trying to enable a situation where people can fit volunteering around their lives. And suddenly that offered a real challenge because having people come and go from a community, there's risk in that travel alone. And ultimately we want to both protect the community in which we're working and our own team. So this is where we came up with a new initiative called DM12. If you jump on a slide, I'd appreciate that. So DM12 was really born out of that desire to reduce the frequency of arrivals and departures, which in turn reduced the likelihood of spread of COVID-19. We asked volunteers to make a 12-week commitment, and we coordinated their travel for them, working with partners such as Airlink, thank you so much, to make sure that they really arrive and depart at the same time. Again, maintain that extra level of safety for the community and for our team. In return for that commitment, we included full support for the 12 weeks, and that included a series of training sessions. This would form both classroom training, where we covered subjects such as disaster management, humanitarian standards, stress and resilience training and logistics, and goes through to the worksite, where we're building capacity with the volunteers to teach them new skills, improve their existing skills, and effectively up the quality and efficiency of our work over that 12-week period. To date, we've coordinated 4 cohorts of between 20 to 40 volunteers to our programs across a number of different locations. And if we jump on a slide, we'll see where those locations are. So on the left of the screen, you see the Bahamas, Texas, and Florida. This, actually, our premonition of returning in September bore true. So these are recovery programs that were operating prior COVID-19 that we've now managed to reopen and return to meet those commitments to those communities. On the left of the screen, I'll pick first the Los Angeles response. So this was actually designed in response to COVID-19 itself, so a step away from our usual work. And there we're working with partners to work with CORE, for instance, on a COVID-19 testing site, and also with people such as the LA Food Bank, as they've seen a great increase in the need for their services as well. We have Mexico, which is, we currently have a team out completing assessments at the moment, and we're expecting to see that come on very early in 2021. And then the main reason why we're here today is really around Louisiana and the various storms that struck that. And you can see that actually Louisiana was the first place that we deployed a team to since our operational shutdown. So if we jump to the next slide, just to keep it moving along, this is actually taken out of an internal document that we use to review the program, which gives you something to look at whilst I talk to you. We watched, so obviously we're monitoring the disasters that happen throughout the world at all times, even though we were obviously working out how we could respond to it. So we watched as kind of tropical storm or tropical depression Cristobal made landfall in June, and then subsequent storms kind of built upon that. Now, we saw Marco thankfully quickly fizzle out as it made landfall, but that was quickly followed by Hurricane Laura, which was a devastating hurricane, as I'm sure many of you are aware. We're able to begin moving response teams into place in preparation for response before Laura hit. After Laura had made landfall and the all clears were given, we deployed an assessment team from both Texas and from Georgia, who quickly identified areas of need in both Texas and LA. To support working in an environment that had recently been struck by the disaster, we established 2 bases, one in a place called Kirbyville in Texas and a second in DeQuincy in Louisiana. That allowed us to get the resources from Kirbyville and get those down to DeQuincy, which had been struck and was without power and lacking the core things. So making sure that our teams were self-sufficient. Now, to deploy the DM12 model takes some time to set up. So we decided that we would not look to use the same model for the initial response. So instead, what we did was we took the staff that we usually use to coordinate and lead the volunteers, and we sent them in to undertake types of work that typically are not easily achieved by groups of volunteers. So these were higher risk, sometimes higher value, certainly more complex pieces of work. So our staff began focusing on that, and you can see here the chainsaw work and tarping, which is repairing roofs with tarpaulin, if no one's aware of that phrase. But again, we're now running chainsaws, which are obviously hazardous pieces of equipment that we need qualified people to run. And we're working at height, which is obviously something that we need to consider from a risk perspective. We continue to build out that specialized team with partners, such as the team from AmeriCorps NCCC and a partner of ours called Community Veterans Response. These skilled teams allow us to continue to build around these scopes of work, which again, at the time were some of the highest value pieces of work that could be done from what the community were telling us. As we stand today, we're designing our recovery program in Louisiana, and that will see our first deployment of the DM12 model I mentioned before. We'll see that early next year. I think it's clear that in this situation, partnership is vital to helping the affected communities recover. It's a tough time for the economy at the moment. We have COVID-19, we have the election taking away media attention from these kind of events. So that's really resulted in less financial support than we've seen in previous comparable events. Unfortunately, that's just at a time when it's more expensive to be able to operate. So my final message to that is, please, if there is opportunity to partner with and continue to partner with Airlink or anyone else attending this webinar, we welcome the opportunity. As of last Thursday, we had completed over 120 jobs in Louisiana using these teams, and we can see we're basically on target for the numbers that we report there. That is the end of my presentation. I welcome any questions if you have any.
Thank you, Gary. If we have any questions from our participants, please type on the chat box. We might address them now or at the end of the second presentation. We certainly thank you for this interesting conversation about all of the safety measures that you've taken to protect your volunteers, which is the main asset on the organization to continue delivering support to those communities. As you rightly mentioned, the attention in the media for the dire situations in Louisiana was not as big as the catastrophic impact of the different storms. So it's definitely appreciated that organizations are taking the time to deploy consistent responses for the recovery needs that are going to take a while. If there are no questions at this moment, we're going to move on with the presentation of Joe, and then we're going to hopefully open the space at the end for questions from the participants. Joe, over to you.
Thanks, Cindy. I appreciate that. Appreciate the opportunity to be here. Appreciate the partnership with Airlink as well. For those that may not be familiar with ITDRC, just quickly, we're a nonprofit, a nationwide nonprofit. We are based in the U.S., and that's mainly where our impact is served here. We're vendor neutral. We work with the entire tech sector to bring kind of the best of their people and products to communities when they need it the most. And so, for us, our litmus test is just, does it benefit the whole community? And if we can check that box, then our resources are available to a community. So we do kind of keep one foot in the emergency management space. We also keep the other foot in the industry space. So we are really an outlet for anybody, whether it's an individual volunteer from the tech sector or whether it's, one of the big tech companies that has an employee volunteering program. We're a vehicle for them to go out and use their skills for good. Next slide, please. So some of the places that we are currently, I think we have a little over 900 sites open around the United States, Puerto Rico, and still some carryover from the Bahamas from Hurricane Dorian. And before you slap me on that, yes, it is another country, but with the need was so great there that we really couldn't say no. So anyway, this is kind of just a representation of where we are. We keep in mind that we're a volunteer-driven organization, and so these are volunteers that are managing this entire operation here. Next slide. So our service priorities, and this is where we have to, I refer to this more than you would think. You would think after 12 years or so that I wouldn't have to, but when we get a request for services, we have to kind of figure out where we have a finite number of resources. Our first cut of resources goes for life safety, our second cut to mass care, taking care of the people and then community recovery, and then long-term recovery. So that'll kind of give you an idea of the types of things that we'll provide resources for, the operations that we'll support, with our resources. Next slide, please. So just to break those down just a little bit on the emergency services side, we normally do get requests for connectivity. That's one of the things, the communication system is certainly the most vulnerable in a disaster, equally to the power grid as well. So we do set up a lot of temporary networks, call centers, we do some stuff within the radio world, a lot of temporary hardware. It's not uncommon for a community to say, hey, we need to borrow 50 computers or 100 computers. That's nothing they can just run down to Walmart and pick up and do, and they'll only need them for a short period of time. So those are the types of things that we provide here. Next slide. On the survivor side, we don't do a lot of one-to-one survivor interaction. We do set up things like Wi-Fi and shelters, public computers, kiosk computers, telephones, cell phone charging stations, things like putting a television in the corner so the kids can watch cartoons and kind of keep their mind occupied while they're in a shelter. And things have changed a little bit, obviously, with this, but given the size and significance of the disasters, congregate sheltering did not go away. I realize that's was kind of the goal, but it actually hasn't. So we've had a fair amount of survivor support this year. Next slide. And supporting the nonprofits, and that's a lot of what we do is empower the nonprofits to go do their mission. We take care of the tech on the back end, so whether it's they just need Wi-Fi in their billets, or whether they need tablets to go out and do damage assessment type things. There's a number of nonprofits that are in this space, and there's a number of functions that we can help them support just by providing whether it's the people or whether it's the actual hardware for that. So next slide. And I promise to get off of the history stuff in just a second, but just as kind of a progression of what our growth has been like over the last 10, 11 years. And you can see where in 2020 so far, this kind of been an explosion of growth this year, much of it due to COVID, but also due to the hurricanes as well. So the next slide. So for us, COVID started back the last week of January. We got a phone call from the state of California and said, hey, we've got this repatriation flight coming in from China. And so we need a place to put these folks for quarantine for a couple of weeks. And for those that haven't seen this is the very first quarantine center, which was stood up in an airplane hangar in Oxnard, California. Fortunately, they came up with an alternative to that, and they put them on an Air Force base nearby. So this site never actually made, but this for ITDRC, this was kind of our entrance into the COVID space this year. Next slide. So shortly after that, you may remember the cruise ship that was kind of sitting out, floating, needing to dock in the U.S. It ultimately docked in Oakland, California. This was our second request for resources, and that was for tablets and compute devices for all the folks that were going to be quarantined that were returning from this as well. So, we really never got any time off from January, to really prepared for COVID. But it became evident that this was something that we needed to, as an organization, kind of retool for and better understand how we're going to respond to these types of events. Next slide. And so then it all started, right? The floodgates opened. We were getting requests from all over the country, and from hospitals, from medical centers, from health departments, from schools. We've had requests for over 1 million computers for students who, when the schools finally closed, for hotspots and things like that. But going back to the chart that I showed you earlier, I mean, we had to make this determination of who's going to get the first cut at our resources. So fortunately, industry stepped up. I mean, our donors were providing equipment for us. We were shipping it out faster than we could get it in and get it ready. But for us, it was kind of the floodgates really opened. And so you can see that, we were shipping this stuff out by the pallet as well. So next slide. Our requests were coming from the big cities. Every major city in the United States requested our resources. Our largest mobile command center, fortunately, happened to be requested by, for Dallas County. And so, for us, it was kind of a short pull to get it there. But every resource effectively inside of our organization, all of our trailers, all of our vehicles, all of our team, notebooks, tablets, whatever that was, it just, was kind of spoken for, had been requested for. Next slide. We were getting requests to do things like this in particular slide is in San Francisco, and there was a census tract that it was particularly hit hard, and they wanted to test everybody in an entire census tract, and it was a 4-day event. So for us, it is things like providing that hardware, providing the connectivity to be able to do a testing event to test thousands of people, and so that's the types of things we've mobilized our folks for. So next slide. The dates, it was funny when Gary mentioned that, we thought we could be back online by September, and we know how it turned out. Well, originally people thought they could just close for a week or two, right? And we would be all back to normal, really by the 1st of April. But this is what, once the country really started closing down, once the schools, the libraries, the coffee shops, everywhere where people go to get their internet, once those places started closing down, then we really kind of ripped the Band-Aid off the digital divide. And it became very evident that there were people who get their internet, their only internet, maybe from school during the day. And so they go back, home to wherever they live, and whether it's in the rural areas, whether it's in the inner city, where they're not able to get connectivity. And so this really kind of created a situation, I guess, in that it was brought to us that, fortunately, this was a federally declared disaster, which checked the box for us to be able to activate our resources. And so for us, it was, how can we reuse what we have to, kind of help bridge this digital divide? So one more slide. So our requests, we're coming kind of from all over, but you could tell that, the state of Washington, which was one of the first areas to get hit the hardest, certainly New Mexico because of the tribal, Pennsylvania, there's a lot of places, I think 44 states we've had requests for, resource requests for COVID. You can kind of see where they're coming from there. Next slide. So we stood up what we called our Project Connect program, and our focus was to connect as many rural areas as we could, rural and underserved areas. And when I say rural, I mean, this is, a representation of a lot of the rural areas we did, where there may be, where the cows outnumber the people. And so this happened to be in rural Washington. This particular access point, I think there are 20 homes that are within 15 minutes of this access point or something like that. So next slide. And these I think we can kind of burn through, but libraries were one of the other focuses. And, when you get into rural America, this is a library. And so, yes, we did set a hotspot at this rural library, and it's just a place where the kids could come and pick up their homework assignments. They could jump online, download, upload, whatever that was. But, certainly rural America is one of the focuses for us. Next slide. But it's the urban areas as well, and we did a lot of work around Detroit. This particular, center, sees about 5,000 kids a year, and so all these community centers like that just shuttered their doors. This is where the kids come for after school. That's where they're able to get help with their homework and whatnot. So the goal of our Project Connect was just to extend the internet beyond the four walls, whether it was a school, whether it was a library, a coffee shop, whatever that was, but to be able to provide open access hotspots in the community. Next slide. Yeah, so this is a very common thing, and we have literally thousands of pictures from our Project Connect crews that have just taken, kind of pictures where as soon as they installed an access point where people would show up, start using it. And so this is kind of what our Project Connect's about. Next slide. Did quite a few access point installations on school buses, particularly around the tribal nations. These are areas that just don't historically have connectivity. And so to be able to, park a school bus in a neighborhood where the kids can come around, again, same thing. They may not necessarily be able to sit for 8 hours and attend a school session, but they are able to get on, upload and download their homework. So next slide. So kind of representation of where our Project Connect hotspots are. We've done around 600 hotspots so far. We're still working to do that. We're still working on this program. We still have capacity left, and we still have more than 100 different communities that are in our pipeline that are being installed right now. But the reason you came, next slide, is really to talk about, I guess, the hurricane season. And so, the hurricane, obviously we've burned through the alphabet, and we're, well into the Greek alphabet again as well. For us, I think the largest one, these are the ones that that ITDRC did actually activate for. Hurricane Laura being the most notable, of these hurricanes this year. And if you want to just press forward one more time, this is all kind of as the rest of the responses were still ongoing of what we're doing, what we've done this year. So let's move forward one more. So for us, Hurricane Laura, and just to kind of give you a snapshot of it, I mean, I'm sure you guys all watch the news, and if you're in the response, space, you probably monitor this very closely. But 6 weeks post-storm, we still saw that, the power was largely out. That they said 30 to 50% of the residents were still evacuated, still 6 weeks after. The schools, they'd still offline, a number of those. We know that Delta came in 6 weeks later. It was only 12 miles to the east. And so, one of the things that we experienced from that is every one of our satellite connections that we'd set during or post Hurricane Laura, we had to go back and reset those satellite connections after Delta blew through. So there's certainly a number of limitations, I think, to what we could do, mainly because, the hotels we were staying in some cases, 1 to 2.5 hours away from this area of operation. With the COVID, it's put the survivors or the evacuees into hotels. So they're not doing congregate sheltering like they, historically had, putting them in gymnasiums or in community centers, convention centers, and things like that. So with the hotels being full, we were having to go in some cases, like I said, 2.5 hours away. And when you have, a team of 8 people, I mean, you think about the man hours that we were burning every day, getting to and from work, if you will, to be able to do our stuff. So that wasn't really sustainable for us. And so we ended up, next slide. We ended up standing up our own fob. That seems to be, our best adjustment for that in this particular COVID time. We've had to do this, for the wildfires in California, where we can't really rely on, some other housing just because that's where the evacuees and the survivors have gone. So in this case, for Hurricane Laura, we stood up our fob in the middle of downtown. Next slide. I'll kind of give you an idea of the footprint of where we are. So this is on a county property. You can see we were kind of co-located with FEMA, a lot of the county resources there. So for us, just being able to, set up and control our own, we brought our own housing in. We had the county provided the restroom facilities, the shower facilities. Fortunately, in this case, that they provide us with our meals as well. So this wasn't a full-on self-sustained event for the first 8 weeks, I guess. We had participation from the county, but this because we're only talking about the hurricanes here, in this particular case, this was a facilitated, a cooperative, response, in conjunction with our government and NGO partners. But we haven't had this luxury throughout the country, throughout our responses this year. In a lot of cases, we've been fully self-sustaining, whether it's bringing our own food in and things like that. Next slide. So the housing, the adjustments for that, this happens to be a 16 dorm bunk trailer, if you will, just to follow the social distancing guidelines. We set a max of 6 heads in the beds here. So we also put dividers up between. Of course, each individual bunk has drapes around it, but we also further subdivided that just to kind of slow the spread of anything. So really, this is just for sleeping. We obviously did not want people to be in confined places, but unfortunately, in order for us to continue our mission, we've got to deploy folks into the field. I will say that we have, drastically scaled down the number of folks that we respond into the field with, just because of, for the social distancing guidelines and just to kind of slow the spread. But, we're still deploying the number of people that we feel, the minimum number of people that we feel like we need to get the mission accomplished. Next slide. So I think, the one thing I can talk about, just responding during the COVID environment is just, obviously your responder and your volunteers' safety is paramount. We have, just like all hands, we've put in a number of policies, just have changed we've limited the example of the number of folks that we're actually flying. And so we're trying to use a whole lot more of local volunteers where that's possible, or having them drive, longer distances than we normally would. The congregate versus non-congregate sheltering has really changed the landscape of how folks respond. I mean, like I mentioned, it means that, we're not able to find housing around just because the majority of the evacuees are all moved into non-congregate housing. Responding orgs, have to be prepared to be self-sufficient. If they're not, then, they're probably going to feel left out. There's a lot of folks, there's less focus right now on opening up communities faster. I think they're more trying to open them safer versus faster. And then you'll find that there's a lot of volunteers that are just not available. We polled our folks back in April, our entire team, to see, what the availability was like for them. I think around 40% of our volunteers said that yes, that they had no concerns, that they were ready to deploy. I think there were around 30%, 35%, if I remember that right, that said that, they would make a decision when there was a deployment mobilization notice. And I think it was 17% of our folks that said, not interested, high risk, that, not going to be able to respond. So you can certainly see where, we're working with less volunteers, and I think everybody is concerned about safety right now. I think it's up to the NGOs just to make sure that they have good practices in place. We've had 0 reports of anybody getting sick on any of our deployments this year, which I think is fantastic. And maybe it's just, good luck. Hopefully it's also, good stewardship on our part. So, and lastly, I'll just say that, I mean, there is a significant disaster fatigue right now, and certainly a donor fatigue as well. So, I think with all the other things that are happening right now, NGOs certainly need to pace themselves, for sustainability. Just whereas we may be used to certain cycles of, giving or fundraising or help or things like that, or even, volunteers, I think you need to just make sure, you're taking a good look at that, kind of pace yourself for that. So that is my presentation, and happy to take any questions.
Thank you so much, Joe. I can definitely see why the 360 disaster response person applies to you. This is very insightful, and it's great that you're dealing with a topic such as the digital divide that sometimes we don't really think that applies to the United States of America, but it does, and it's great to be aware of the different realities. Certainly, that picture of the rural library will stick with me. And it's a great reminder about the need to ensure everyone or no one is left behind in the midst of the pandemic. So we're now going to open for Q&A from our participants. We have one question on the chat from Willem Joseph. And so I'm going to read the question right now, and then you can decide who would like to answer first. What type of methods do you use to plan your logistics schedule in order to achieve an effective and cost-efficient emergency response? And the question continues, do you use operations research, such as vehicle routing models, to find an optimal schedule? So this is how to plan logistics schedule effective and cost-efficient. Gary, would you like to take this question first, and then we pass it over to Joe?
I'm happy to try. It's very much a logistical question for sure. And to be fair, I don't think we have this level of maturity in our logistical approach. really we're bound by where our assets were as we plan our response. So as we had a team in Rockport in Texas anyway from Hurricane Harvey, it was an obvious choice to deploy from there. And then we have a warehouse in Atlanta, Georgia, where we keep a truck full of response equipment. So there was relatively few choices for us to make. And again, once we're in, we tend to move around within quite small areas of communities that have been affected. So the short answer is no, we did not use any of those mechanisms, but I'm certainly interested to learn a bit more about them. I'll ask my logistics person.
Yeah, I should screen shoot this as well. For us, one of the things that we've, one of the big modifications we've done, we're shipping a lot more. And so that way it's kind of keeping our people out of less of a contact, if you will. So for us, if we're able to ship, so for example, we were getting requests, for hundreds of computers and, all along the West Coast. And for us, it was, to be able to palletize those, send them. We didn't necessarily send a volunteer to meet those or a team of volunteers to meet those. So, for us, the shipping was, was more of a safety type thing. We do have a logistics team, a logistics section, and they work pretty closely with the plans. With the mobilization team, to work on as far as what the most efficient routes are for our people to get there. But again, for us, we've gone more for I guess because we're distributed in the way that we are, because our assets are distributed in the way that they are, it is typically the closest cache for physical resources. Fortunately, Louisiana, we're based in the Dallas-Fort Worth area. Everything that happened in Louisiana and even into Alabama, we were able to serve that really from our DFW cache. So it was all part of our central division. So for us, I think it was just, we pulled trailers with additional equipment down just because we were not expecting to have as many volunteers, who could come back and backfill us or bring something over, hot shot something or whatever that was. So I think for us, we made our deployment loads a little bit heavier. We spent more time focusing on, taking care of being more self-sufficient. And then again, it was, so much more was, how much can we offload to the freight carriers. So if that answers your question.
Thanks, Joe. Yeah, I believe that answers the question. We invite all of the participants to provide further questions. Meanwhile, while they feel ready to ask something, I did wanted to comment on the fact that I find quite impressive that being mostly volunteer-based organizations, in the case of the ITDRC, you managed to have 0 cases. I think that definitely speaks to the level of the plans and preparedness that you've had. And it's also quite amazing for all hands and hearts, the way you're deploying the DM12 program, that you managed to really isolate those cases and mitigate the impact of any potential illness. So I wanted to ask, to elaborate a little bit more on that aspect of managing the volunteers. How has it been, that experience of your usual process to select, to recruit the volunteers? Do you have additional measures now in place to communicate and to manage those expectations with your volunteers? What have you seen from their either concerns or motivations to volunteer in such an environment? How do you keep that base engaged, basically?
I'm happy to go first, Joe. So there's quite a bit to unpack within there, and we did lots within it as well. So because we had a reduced number of people that we could take, we did take the opportunity to introduce a new way of coordinating and choosing who those volunteers are. So we had a application process that saw them answer a number of questions ranging from previous experience to diversity, equity, inclusion factors, trying to make sure that the team that we put together for 12 weeks were going to make a strong team, right? So certainly our selection process changed because we're able to in this new environment. I think supporting the volunteers and our staff has been a learning curve. And I think that one of the big things that we've seen is, we know that going into a post-disaster environment, gives you access to secondary trauma, to potential issues that create mental health problems within yourself. And I think that COVID-19, the crisis, which really does include both the health issues and the economic impacts, had affected people's baselines. So people are coming in from a place of less safety anyway into an unsafer place. So we focused and are continuing to focus on building that safe space within this environment, given that, again, everyone's baseline is really jarred at the moment. So that's something we're continuing to invest in and work out new ways and making adjustments to our adaptations to make the environment, to maintain the safety, but make it as effective and as nice a place to be as possible. So they're the two main things that occur to me from your question. Thank you.
I think for us, most of our volunteers they kind of know their comfort level, their limitations. And so I think, one of the forms we ask on deployment availability is, there are a number of questions, and certainly, have you traveled, during this time period, and where have you traveled? Have you been exposed to whatnot? But I think for most people, we ask them, if you're high risk, and we do still have folks that submit availability. I mean, we're one of those organizations where we do have a remote response team. So we do have people that can still support our deployed crews there. And so I think that doesn't exclude people from being able to participate and support, remotely. But I think everybody's been pretty open about, whether they felt like they were high risk and then they were willing to travel or not. So I think, everybody kind of has a strong opinion. I don't think anybody's really on the fence, right? I mean, people are like, yes, I'm all in, or no, I'm not interested. I don't want to travel on an airplane or whatever that is. I think so, for us, it's been a pretty easy selection, but we do look, even though somebody submits availability, we do go through a little bit further and just try to figure out, does that skill set that this person has, is that going to allow us or enable us to not send two people? For example, does this person have, multi-skills so we can actually work with a smaller team? So good call on that, Gary.
Great, thank you. This is definitely amazing to learn about all of those adaptations and how you kept your operations going to provide essential services after a disaster. I think with this, we're coming to the end of our webinar. It seems that we do not have further questions on the chat box. I'd certainly like to thank you for your time this morning. I think we've learned a lot about the way ITDRC and All Hands on Heart is responding. It's continuing to support communities through the COVID crisis, and especially with this very intense hurricane season. And we certainly look forward to continue working together to ensure we continue supporting those communities. Thank you once again. Any closing remarks from your side?
No, just want to thank you for the opportunity. I really appreciate it. Appreciate the partnership and all the great work you're doing.
Exactly the same. Just thank you so much to Airlink for coordinating this, for all of the help in the past and in the future, and to any of our other partners or future partners out there. We look forward to working with you.
Excellent. And thanks everyone, to our participants, to everyone who joined this morning. We certainly hope we will be able to see you on the next webinar on Thursday and Friday for the Vaccine Distribution Challenge. Well, everyone have a good day. Bye.